Hi everyone, I'm Dr. Lavanya Aribandi, Chief Medical Officer of ekincare. Today I'm going to talk about effect of lifestyle on health. If I ask you a question, are you healthy? What would be your answer? Some would say yes, I'm healthy. Some would say maybe, and some would say no. But what is health? Let's look at the definition of health and ask this question one more time. As per World Health Organization, health is complete physical, mental, and social well being, not just mere absence of disease or infirmity. Now, let me ask you this question again. Are you healthy? Now, the answer might vary a little bit now compared to before. But before we get all cynical about how unhealthy we are getting, let's look at some of the positive good things that happened since the time of independence in India. At the time of independence, do you know what life expectancy of Indians was? It was approximately 42 years. On an average, many people died before they reached 42. That was very bad. Now, there were many reasons for that. But ever since, the life expectancy of Indians kept on increasing, and now it is at about 67, 68 years, and it is bound to increase in the years to come. We can attribute a lot of things to this increase in life expectancy. The sanitation got better, drinking water facilities got better, there is lesser malnutrition, though we yet have to reach better standards. Now we have vaccinations to prevent a lot of deadly diseases. We have discovered antibiotics to tackle a lot of infectious diseases. All these things improved living standards. But yet, we are dealing with another problem. Now we are having double burden of disease in India. Though we eradicated smallpox, which swept away villages one time and took a lot of lives, though we have kept malaria, tuberculosis, polio, cholera to some extent under control, we still are battling with these infectious diseases. And we have antibiotic resistance and some other problems that we have to battle now. Besides this burden of infectious diseases, we have another burden called lifestyle disease burden. That's why I said double burden. We can actually say it is triple burden if you actually take how pollution is affecting and how pollution is increasing disease burden. So we have to deal with this triple burden. But today our topic is how lifestyle diseases are causing disease burden in India. Now, before we get further, what is lifestyle? How do we define lifestyle? Lifestyle is what we eat, how we eat, what time are we eating, are we exercising? If we do, how much are we exercising? Are we sleeping enough? More importantly, are we having quality sleep? How stressed are we? What are our habits? Are we smoking? Are we taking alcohol? How much are we taking? All these things come under the big umbrella term lifestyle. Now let's analyze each of these separately. If you look at our food habits now, it's much different from what we used to eat 30 years ago. We used to eat a lot of unprocessed food, diet made from scratch. But now we have a lot of processed food that we take in our daily dietary intake, and we have ready made food available. And we are indulging in high calorie, high carbohydrate, high fat, that to saturated fat diet. So, all this led to obesity. Now, India, while battling with malnutrition on one hand, is also battling with obesity. Now, let's talk about physical exercise. With industrialization and urbanization, and especially with the invent of wheel, we have lesser physical activity and more of commute by public transport or private transport. This, along with longer job schedules, people really have very little time left for exercising. Along with high calorie intake and lesser exercises, naturally obesity is the result. Not only just the diet and physical exercise, our sleep quality has gone down too. As per statistics, most of the urban cities in India, on an average, people are spending 30 minutes less in sleep compared to 10 or 15 years ago. More importantly, the quality of sleep also may be going down. Along with these, with the demands of modern life and family demands and work related demands, stress levels have gone up. Stress hormone cortisol is really taking toll on our health. Now, coming to our other habits. We all know that smoking increases risk of cancers, risk of respiratory diseases and coronary artery disease. Despite that, smoking levels have really not gone down in the last few years. It has gone down a bit but not as much as we would intend to. And on top of that, number of people taking alcohol has increased. We all know that alcohol causes liver disease and number of cancers and other conditions. So all these compounded with bad diets, irregular exercise habits, bad sleep, high levels of stress, intake of smoking and alcohol have led to what we call lifestyle diseases or non communicable diseases. Now, what are these lifestyle diseases? Diabetes, hypertension, heart disease or coronary vascular disease, stroke, respiratory diseases, and some other diseases like polycystic ovarian syndrome, infertility in women. All these are called lifestyle diseases. There are many more lifestyle diseases too. If you see the statistics of diabetes, few years ago we had about 65 million people in India who were suffering with diabetes. But by 2030, the estimate is that this number will reach to 100 million people. Now, India is called diabetes capital of the world. Again, if you take hypertension, hypertension has become much more common not only in urban areas but also in rural areas. 1 in 4 people might be suffering with hypertension. But the more worrisome thing is only 1/3 of people that have hypertension know that they have hypertension. And of these people that they know, only 1/3 are taking treatment for it. And of these people who are taking treatment, only 1/3 of people really have their blood pressure under control. Now that's a worrisome thing because hypertension is a risk factor for stroke, coronary vascular disease, and all these things. And most of these non communicable diseases are also caused by air pollution. 1/3 of deaths caused by lung disease, stroke, are caused by air pollution, and 1/4 of deaths caused by coronary artery disease are caused by air pollution. On top of this, mental health diseases like depression and anxiety are on the rise. Lack of social support system, loneliness, and people moving a lot and frequently from one city to another city, all this is leading to social isolation and sometimes loneliness, increasing the incidences of depression and anxiety. It is time that we focus more awareness and attention on these psychological illnesses. On top of these, because of all these lifestyle changes and social changes, substance abuse is on the rise in India. Unfortunately, we don't have good de addiction programs, evidence based programs for de addictions. If you consider all these things, most of the time, if we can correct our lifestyles, if we can change little bit, if we can find solutions to the current problems, we can somehow, somewhat decrease the incidence of lifestyle diseases or non communicable diseases in India. At present, in India, about 9 to 10% of people are affected by diabetes, and it is increasing gradually year by year. Now, how do we tackle diabetes? Diabetes is a lifelong condition, it's a chronic condition. So, the basic principles of tackling diabetes are first of all, knowing about the disease, that is, increasing awareness on how it is caused and what is required to tackle this disease. And second one is having regular follow ups with the doctor, and more importantly, contributing to your disease management. The more aware you are, the more you will be able to discuss the treatment plan with your doctor and be able to take informed decisions along with the help of your doctor. And in the treatment of diabetes, it's not just the medicines, it's more of a lifestyle. We call it multi-pronged approach. Diet intake, exercise really play an important role in diabetes. Taking diet on time in small quantities, that too the diet that has low glycemic index is very important for diabetics. The glycemic index is how fast your blood glucose levels are raised after you take certain food. White bread, simple sugar, bakery items, and all these have high glycemic index. So, high fiber diet has lesser glycemic index. Knowing and following these basic principles of diet and eating small quantities many times, taking mid morning and mid evening snack that too that is healthy are very helpful for diabetes. Similarly, regular exercise is very important for blood sugar control for diabetes because regular exercise will increase sensitivity of insulin. Now let's talk about hypertension, which is another lifestyle condition. Obesity, alcohol intake, family history, all these are some of the risk factors for hypertension. Having weight under control, even a modest reduction of weight, can help you control your high blood pressure. Taking diet that is low in salt will also help in managing hypertension. More importantly, for hypertension, regular doctor's follow ups and disease education are very, very important. Again, hypertension also requires a multi pronged approach, not just taking medications, but also controlling diet and regular exercise and having stress free schedules and managing your stress very well will help in control of hypertension. If you see, the main reason for these lifestyle diseases in many situations is obesity or overweight. Taking more calories than required and inability to burn these calories that we have consumed is one of the main reasons for obesity. On top of that, stress, stress causing elevation of certain hormones, leading us to take more and more and leading us to exercise less is another reason for overweight or obesity. Obesity puts us at risk for diabetes, hypertension, certain cancers, and some psychological problems. And in women, conditions like PCOS, that is polycystic ovarian syndrome, and infertility, and many more. To understand the reasons for obesity, to eat smartly with the help of a nutritionist, with the help of a diet chart, with food items that are healthy, that suit your eating habits, is very important to lose weight. Help of an exercise specialist or physical therapist to guide you with your exercise regimen to motivate you constantly is also helpful if you want to lose weight. In the coming videos, we'll talk more about how these lifestyle diseases can be tackled just by making few changes in our daily routines. I hope with the help of your doctors, your health coaches, by increasing your awareness, by having a little bit discipline, you will be able to handle these conditions very well and have a happy and fruitful life. Take care.